Hey everybody, we've got another heart today. This is number 1511 in our collection, and the heart would have sat roughly in the chest like this, with the anterior surface coming out towards the screen, the posterior surface towards the turntable, inferior legs down here, superior head up here, left over here, right over here. We'll start off by doing what we usually do, which is trying to identify the right atrial appendage, at least externally. And when we try to look here, we actually find something interesting, and we find that there appear to be two appendages, one that looks to be potentially a right atrial appendage and one that looks more like a left atrial appendage, but they both sit to the left of the aorta. So there is, in fact, juxtaposition of the atrial appendages. So what we'll do is we'll just go ahead and go to where we think the right atrium is. And we can see that this right atrium has been opened previously. We also find evidence of some pacemaker wires. And when we open up this right atrium, we find that there is an atrial septal defect. It's a little difficult to see from this side, but there is an atrial septal defect here in the oval fossa. And let me try to open that up more. And there we go. There it is right there. And it is a little difficult to identify the other structures in this right atrium. So we'll go ahead and move to the right ventricle, or what appears to be the right ventricle. This is a ventricle with coarse trabeculations. And we do find that the valve leading into it does have 3 leaflets. And there are direct septal connections of this valve, consistent with the morphologic tricuspid valve. Now, when we take a look at this ventricle, we do find that there is a ventricular septal defect here, and it does appear that the tricuspid valve courses through this a little bit, and when we look at this VSD from the left side, we do find that there is continuity between the tricuspid valve and the mitral valve here. And so this would be considered a central perimembranous ventricular septal defect. Now going back to the right side of the heart, immediately we find that there is one outlet here. And we see that there is a great vessel that appears to be the aorta that arises anteriorly from the right ventricle. And we find that within the sinuses of this arterial valve, which we assume is going to be an aortic valve, there are, in fact, coronary arteries arising. So here's one of the coronary arteries here, and then here is the other coronary artery. So then here is the aortic valve, 3 leaflets with 3 sinuses. And here is the ascending aorta, transverse arch, and then the descending aorta. So then the question arises is, where is the pulmonary trunk? And now when we look for the pulmonary trunk, we find that here is a left pulmonary artery, here is a right pulmonary artery, here is the pulmonary trunk. So we'll go ahead and pass our probe through to see if it goes through and where it exits. And when we do that, we do see that the pulmonary outflow tract is also, the pulmonary valve arises from the right ventricle as well. There does appear to be stenosis to the pulmonary outflow tract here, and that the aorta is in fact anterior and rightwards to the pulmonary artery. So we have double outlet right ventricle with a ventricular septal defect, and 100% of both the aorta and the pulmonary trunk arise from the morphologic right ventricle. Now let's go over to the posterior aspect of the heart here and go ahead and open up the other atrium. When we do that, we find a smooth walled atrium, and here is the atrial septal defect here. And we do find the mouth of the left atrial appendage, and we can see that all the pectinate muscles are confined within the mouth of this appendage itself, consistent with the morphologic left atrium. We see that the left atrioventricular junction is guarded by a 2-leaflet valve that doesn't have any direct connections to the ventricular septum, consistent with a morphologic mitral valve. And here is a ventricle that's got fine crisscross trabeculations consistent with a morphologic left ventricle. And then here is the VSD that we've already seen from the right side, and we see that there is fibrous continuity between the mitral valve and the tricuspid valve through this ventricular septal defect consistent with the perimembranous ventricular septal defect. And there is no outflow tract arising from this morphologic left ventricle, as we know that both the great arteries arise from the morphologic right ventricle. So here we've got a heart that has usual atrial arrangement with an oval fossa atrial septal defect. There are concordant atrioventricular connections. There's right-handed ventricular topology with a central perimembranous ventricular septal defect. The ventricular arterial connections are double outlet right ventricle with pulmonary stenosis with an anterior and rightward aorta. And other than a pacemaker placement, doesn't appear that there were other operations done, at least from the initial glance at this heart. And not to forget that there is, in fact, juxtaposition of the atrial appendages.